The global shortage of surgeons disproportionately impacts low and middle-income countries. To mitigate the chronic health workforce shortages, some countries train non-physician clinicians to perform procedures that were historically only carried out by doctors, a response termed task shifting and task sharing. The task sharing concept is one that is supported and recommended by the World Health Organization, and for 20 years, Zambia has invested in training medical licentiates to fill the human resource gap in the delivery of health care.
They've been able to save a lot of lives. In fact, to date, some of our districts, the people who are running the theaters, who are saving lives are the medical licentiates. They are able to do a cesarean section in the rural, remote parts of this country and save lives.
Their contribution to providing essential surgical services in district and rural hospitals in Zambia directly addresses a critical dimension of health equity.
Medical licentiates have really filled in the gap that has been there for some time because of the shortage of doctors.
Even when they come here, it's not that you have direct entries only, but you have a mixture of both in-service and direct entries. And those give a good buffer in terms of human resource.
This is St. Margaret's Mission Hospital in Chifunabuli district in the Luapula province. The hospital is about 115 kilometers away from the provincial capital Mansa. Evans Nyumbu is a medical licentiate practitioner and works for St. Margaret's Mission Hospital.
My favorite place is the theater. I love being in theater, operating on people.
SolidarMed and Liechtenstein Development Service have been supporting the health sector in many ways.
And in our early support, we were involved in direct training and providing clinical expertise to help train up medical licentiates in things like surgery, pediatrics, etc. More recently, in the last 2 years, we've shifted our focus to supporting the systems that underpin good undergraduate clinical training. That is, we are assisting in improving the teaching quality, so that is helping doctors with teaching skills and what we call pedagogical skills, and we also helping to improve the learning quality. And in that space, we're working with partners at Heidelberg University to develop e-learning content and to help develop the learning platforms so that ML students, wherever they are in Zambia, can have access to good quality learning materials.
We also recognise that it's quite difficult for health workers, particularly in rural Zambia, to get good housing. And there isn't enough housing, and it's sometimes not in very good condition. And it's demotivating for them to stay in a rural area if they don't have good housing. So one of the things that we've done is set up a social enterprise that builds and rents houses as an affordable rent to healthcare workers. And it therefore creates a revenue stream whereby we can maintain those houses and even build some more.
Richard Tuchili is a fourth-year student at Leben Medical University and worked as a clinical officer before enrolling into the program.
It has brought me to a realization that there's so much that I thought I knew, and being involved in the inner circles, it has made me a better clinician.
Medical licentiate practitioners are making a huge difference in the lives of many in rural parts of Zambia.
The importance of this cadre, this assistant medical doctors, is so important even today, especially when you look at the fact that this country is huge. We have many health centers across the country, including the new ones which in the last decade have been constructed but have no doctors. We still feel that this specific cadre could actually help us. So their importance will continue being recognized and appreciated.
With their rare skills, medical licentiate practitioners are filling the human resource gap in the delivery of health care.